Hello, my name is Stephanie Ingram, and I am working on my presentation for informatics for nursing. Um, we are talking about supporting consumer information and educational needs. Um, Many people now go to the search engines that they have available, such as WebMD, Google, Wikipedia, where you can find out just general information of things that are going on. However, the details that make up the difference in diagnosis remain unknown to them. Also, not all information is up to date in many cases. For many of these sites, they are not written or monitored by medical professionals. Here are just three examples of the reasons why these sites are so successful. The lack of insurance. The lack of insurance leave many without access to professional medical assistance. So they seek out these sites in order to aid themselves and to identify problems that they have going on with them. Um, Many receive assisted care. See Many receiving the assisted care see it as an opportunity to take control over their health. So a lot of people, they don't want to rely completely and totally on medical professionals and their education. They want to gain knowledge for themselves. And then you have parents and caregivers that are looking for information to treat minor problems, minor issues that they don't have to go to the doctor about. There are several ways to attempt to identify certain illnesses. Some search engines, when you type in a certain illness or a certain diagnosis, you get tens of thousands of different search sites of newsletters of places that tell you or try to explain what's going on with you. Um, some of this could be a potential problem because sometimes these sites are accurate and sometimes they're not accurate. Um, and sometimes that's as far they may give you the symptoms, but that's as far as it may go. Other sites are centered around a specific disease or disorder. If you feel like you may have a particular illness, then you go to one of the many structured websites and see if this information applies to you. WebMD, WebMD is one of my favorites. WebMD, it's very popular. It takes you beyond a list of symptoms and symptoms. It's monitored very carefully by healthcare professionals. They have call center, and then you can also even make appointments. Wow. Um, there are pros and cons to internet access to medical information. On the positive side, people can take more control over their health issues, identifying the need to seek a doctor and allowing them to participate in the process. For example, the eHealth initiative, it was created to monitor websites giving medical information to assist the public by ensuring information is correct and to protect the public by calling attention to those sites containing false or only partially correct information. On the negative side, there is false information and even propaganda to be found online. It can be dangerous to approach what can become a life altering situation with the wrong information or just enough correct information to be dangerous. HCOs, they use a variety of approaches and tools to promote patient education and healthcare literacy. Most offer physician search capabilities, e-newsletters, and call center tie-ins. So of course we have to keep the data correct and we have to keep it easily accessible, but also putting information into terms that people can understand. Uh, I work on I work at Baptist on 5A on the neuro floor, and we are considered the Stroke Center of Excellence. And we have a booklet that we pass out. It's called the Stroke Educational Manual, And in this manual, since we deal with a lot of CVA patients, in this manual, it tells you signs and symptoms of a stroke. It tells you risk factors. It tells you what to expect basically during the hospital stay. And then it also tells you what to expect once, kind of gives you a coping, the way to cope with this terrible situation that has happened to you. So there are a lot of different ways that you can obtain knowledge and you can obtain information about healthcare illnesses. You just have to be careful of what you use. Thank you.